Welcome back. It's time for us to take the health segment right here on Wake Up Nigeria. Now, we do what we can to give you as much information about different health matters. So hopefully you can take some steps to making sure that you're a lot healthier, especially you and your loved ones. With us, we have, joining us to share some facts on hypoglycemia, Dr. Diran Onifade. Now, he's interested in the developing state of health in Lagos State through adoption of health technology. And he's a regular here on the show now. Welcome back.
Thank you for having me once again.
So we hear a lot about many different blood disorders, blood issues. We also have talked quite a bit about diabetes over the past few weeks. Only once or twice have we heard, hypoglycemia. So I was hoping we could give people a little insight into what it's all about and how they can look after themselves. Okay,
so we've been talking about diabetes in the past few sessions. So diabetes is hyperglycemia. That means the sugar is high. Yeah. And we know that whatever that goes up is going to come down. So positive, there's negative. So if there's high blood sugar, there's definitely going to be low blood sugar. Okay. So hypoglycemia is when the blood sugar level is low. Okay. As against when it was high in diabetes. So hypoglycemia simply means when the sugar level is low. So the confusion now is people with diabetes or, diabetes-like symptoms are often looking for a way to reduce their blood sugar. Yes. They are looking, but they're not looking to be hypoglycemic. No. Right. No. Okay, so please explain. Okay, so there's a range for us to say your sugar level is high. So if it is not high, which is normal, that is normal sugar level, that is what everybody needs to be. You need to be in that bracket of where your sugar level is normal. Okay. When you go above it, that is diabetes. Okay. When you go below it, that is hypoglycemia. Okay. So the goal in treating diabetes is not to make you be hypoglycemic, which itself is very bad and can actually kill you faster than the diabetes. Wow. Yes. Okay. So you have to be very, very careful that when you are treating someone with high blood sugar, you don't tend them to low blood sugar. Rather, you make it to be normal range. Okay. You make it to be normal range. You don't make it to go down. So that is the technicality about that. So let's talk a bit about the symptoms of hypoglycemia now. Okay. Because we did touch a lot on symptoms of diabetes. Yeah. What are the key indicators that someone could become hypoglycemic? Yeah. Okay. When your sugar level is low, it's just like when you are hungry. Okay. Your cells are hungry for sugar. There's no sugar for them to have. So you become jittery. Okay. You will not be able to concentrate. Okay. You start sweating excessively. At times, the person might be hungry, the person might not be hungry. It depends on the cause. But the sweating and the jitteriness is one of the things that give it away. And the person will start having a fast heartbeat. Because the response by the body is, no, I want this thing, I want this thing. Just like when a child is asking for something. Okay. That is what happens when your sugar level is low. Once you see those signs, and in a previously maybe diabetic patient that is using drug, you have to be very, very cautious that what is going on. Why is this person jittery? Why is this person sweating? You see the palms to be very, very sweaty. You see the person cannot concentrate, you cannot assimilate, and a whole lot of all those things. Most likely, the sugar level is low. So what is it that they need to do at this point? Because as we said, we don't want the sugar level to get too high. What are the first things that anyone suspecting that they have hypoglycemia should do? What should they do? It's very simple. In fact, while I was in medical school, we had one case of someone that is having all these symptoms. And all we did was just a bottle of all these sugary soft drinks. Yeah, I don't want to mention a brand. Yeah. So just a bottle of all these soft drinks can just solve the problem. Really? Medically, if they bring them to the hospital, we tend to give them a fruit that contains sugar. Okay. And that we just give. But if you don't have all that and you just notice all that, just get any of these soft drinks that have sugar in it and you're fine. Really? It's as simple as that. But isn't that what we were trying to avoid? Yes, but this time around, you have tipped the person not. And this is what happened. They say, this man is diabetic. We don't want to give him drink to take or all that. We don't want to give him any of this soft drink to take. But this person has gone way beyond where we want him or her to be. Okay. So you just have to just give the soft drink and all that. Even if what you have is put a cube of sugar in water and give this person, you'll be fine. Okay. Then after that, that's not all. They will now have to find out what is the cause of this hypoglycemia. Okay. Is it because you have taken too much of your diabetic drug?
Okay.
Or is it there's something else in your system that is causing it? Probably your pancreas, one organ in the body that is not working effectively the way. So that's when we now start doing a raise of investigation, so it's not going to repeat itself again.
Okay. So this investigation, is this something you recommend immediately you notice someone is hypoglycemic, or do you just wait for a particular period of time, or is there a medication you prescribe? Once
you see that sign, the very first thing you can do if you have the glucometer is you quickly do the finger prick.
Okay.
And that's why with our Doctor Connect thing, what we have is that we have all in one together where you can check all these things.
Okay.
When you check the sugar level, once it is low, sometimes it might be as low as it will not even bring any result. You just be seeing low from the machine. Wow. Just going to show you that it's low. So that way, just give the person any sugar drink, and the person is going to be fine.
Okay. All right.
Yes.
And that's all they need to do, basically?
For that emergency treatment, that's all they need to do. But you can scale it up and bring the person to the hospital for us to now know what exactly tipped this person into the hypoglycemia. Is it that he's taking overdose of the drug? Is it that there's something in the system that's not working perfectly? And we scale it up from there.
All right. So now, you did initially scare us a little when you said hypoglycemia could kill faster than diabetes.
Yes.
So how did you mean?
Okay. If your sugar level is high, complications might start happening over time. 1 year, 2 years, 3 years, and all. And you can start taking drugs before it starts affecting your eyes, your brain, your heart. That can give you like 5 to 10 years.
Wow.
If you have hypoglycemia now, you can die within minutes.
Wow.
Because the brain is not getting enough sugar. The brain needs a lot of sugar to work. The muscle needs a lot of sugar to work. All of them, all the cells in the body need sugar to work. And if it is down, the person can just die. And that's what there's something to say in medicine that you rather treat person for hypoglycemia immediately than for you to worry that it's hyperglycemia. Because if you don't treat the hypoglycemia, because there's different type of hypoglycemia can cause a coma, hyperglycemia can cause a coma. If the cause of the coma is because of the hypoglycemia and you don't treat it by giving more sugar and you are worried that the person has diabetes, the person must have died before you realize that it's hypoglycemia.
Wow. Wow.
Yes.
Wow. Doc, hopefully the message is clear and it's connecting with someone out there. But I think overall, we all need to take our health a lot more seriously, and we all have to go for these checks, these medical checks, ever so often. How many times should we go for these medical checks?
Yeah, it depends on the family history. If you have history of diabetes in your family, probably you can do it like once 3 months, once in 6 months. If you don't have any of that and you don't have any symptoms, once in a year is fine when you are doing your annual checks.
All right.